There's a well-known Canadian psychiatrist, Harvey Chochinov, who's done a great deal of work on dignity in cancer. And one of the key phrases he mentioned is that people dissolve readily into patients. And I think that's what hospital treatment does. And if you meet someone at the end of 4 or 5 year journey of treatment, intense treatment sometimes, one of the joys of this job is helping that human being to emerge from being a patient. So the Wesley Palliative Care Service has been here for about 11 years, and initially it was envisaged as a service that would provide people with quality care at the end of life, and we still do that as our core part of our business. I guess what's changed is we've started to accompany people much earlier in the journey through their illness, and that includes aspects of symptom control, but also psycho-spiritual support as well, helping people to adapt to the changing needs as time passes and the aspects of their illness change. If we look at the core value, we have a value in the human spirit. That's a job that's too big for one person. So while there are doctors like me, we have a wide range of staff in our multidisciplinary team, and that varies from nurse specialists and nurse managers and the nurses who work on the floor of the unit through to physiotherapists, occupational therapists, counsellor, chaplain, pharmacist, dietitian, etc. So what we try to do is provide a service that's holistic, that we care for the entire being.
On a daily basis, the primary aspect of my role, the greater proportion of my day is spent actually in care with patients and relatives, supporting them. And the other major aspect of my role is to support the staff. We believe very strongly that if we support our staff well in their emotional care and in their education around psychosocial issues, then our patients and relatives will certainly benefit. And I believe that we get justification that gets confirmed all the time by our patients and relatives when they tell us how well they feel the staff have cared for them in that way, how they can really feel that the staff get along, that they are well cared for as well. So that sort of environment is very tangible.
When a person's had a diagnosis of a life-limiting illness, there is disbelief and there's that shock and a lot of anger sometimes. So what we would do then is to sit with them in that pain, not try to sort of cheer them up, sit with them in the pain, but then also help them to turn a corner and see that there are actually possibilities when they've had that prognosis. There are possibilities of reconciliation with people, lots of things that are actually more life-giving than life-taking. Palliative care service at the Wesley is made up of some of the most extraordinary human beings who have this incredible capacity to offer empathy, compassion, but also great skills.
My wife was diagnosed with breast cancer in 2003, and she died in 2007, in February 2007. The medical staff and also the chaplains here were just wonderful. I felt that this introduction between when you're diagnosed and then into this area eventually, we should try and meld it together. And that's what basically I tried to do. And also fundraising, there's always a shortfall in every department of every hospital because they can't get all the money. And I felt that I could probably help in some way in fundraising.
So the palliative care service here is unique, and I think something we would all like to see continue. It certainly provides a service that can't be gained elsewhere, and that's for patients right across Queensland. The difficulty, I guess, in many things comes down to how such a service is funded. We rely a lot on voluntary donation and people's goodwill, and the goodwill of the Uniting Church and the Wesley Hospital at large. So to keep our service running, we need that goodwill to continue.
I sometimes think of myself as a coach on the sideline. I'm not making these things happen, but I'm there and perhaps suggesting and guiding ways of them tapping into that patient's human spirit. And often families will really come to the fore as well with this amazing surge of, we can do this.
We had quality time with her, and to us that's the most important thing.
I guess in terms of a legacy that I would like to leave in some respect, I think essentially is that people would stop viewing palliative medicine as a special area of medicine for treating people with cancer or a life-ending illness. I think it's the way we should treat everybody, and I think it's the way we should treat each other as colleagues and as patients. I think if we approach each other with humanity and respect each other's dignity, then I think medical care will move forward with an enhanced reputation, and people will have a much greater satisfaction of their relationship to doctors and hospitals in general.